Hello again, everyone. Dr. Dan Bachman here. I want to give you a quick update on my recovery process for the colorectal cancer that we've talked about before. This is my second video. Today is June 24th, 2021. So just a couple of days after our last video. And I did meet with my oncologist yesterday, Dr. Jaramillo. Again, she's fantastic. She actually called me from the beach when she was on vacation in Hawaii just to let me know she was thinking about me. She actually reviewed my CT scan while she was there. So, I mean, I couldn't be happier with my care team. But the important takeaways from that meeting. So the new things are she got a chance to look at my CT and my MRI, which I had 2 days ago. MRI of abdomen and pelvis, both of which are looking for, hey, has this thing spread, and if so, where? And well, it turns out it has spread, and she told me that I am in fact stage 4, so which is the worst of all the cancer types you can have, of course. So not what I wanted to hear, but there's a but for this. So yes, stage 4, but she describes it as micrometastatic disease. Micro meaning small. Metastatic means the cancer has spread to other places. So metastasis, which is the spreading, that's the thing we don't want, and the more it's spread, the higher staging it gets, like stage 1, 2, 3, or 4. So yes, it's other places, but just very small little areas. So they found in my lungs, they found 5 spots in my lungs that may or may not be cancer. She said those could be, you know, maybe you inhaled something that irritated your lungs 20 years ago, and then you've got a little bit of fibrosis or scar tissue, and that could be all it is. We don't know. But there were 5 different spots. They're all very small. She kept stressing how small they were. And 5 spots in my liver. Again, we don't know if those are cancer. But liver is, in particular, liver is the first place that colorectal cancer usually spreads. So it is a suspect. So I'm kind of expecting that the liver may in fact be cancer. The lungs we don't know, but we're going to confirm this with a PET scan, which is a third kind of imaging that we're going to use, and it's more specific. So she said the PET scan, and I think it'll be maybe full body. And that happens next week. I can't remember which day, but someday next week I'll be getting a PET scan with contrast. Again, the contrast just makes things show up more clearly so they can see what they're looking for. But the PET scan tells them if there's any activity in those spots. So if it was, for example, like they found a little spot in my pelvic bone, my ilium, that could be something that's called a bone island, which is a normal thing that happens in bone. You just get a little, you know, you got a big broad piece of bone in one little section. It's just denser than in other areas. There's nothing scary about it. It happens in all kinds of folks. But we can't tell from the CT or the MRI whether that's cancer growing in the bone or if it's just a bone island, which we want it to be. PET scan will see if there's any activity, meaning is that little spot, is it growing and metabolizing, or is it just a little dead spot in the bone, or just a little piece of scar tissue in the lung or the liver. So PET scan happens next week, so we'll get more data to kind of clarify some of these things. And the fact that they're small, she said, means that they very often respond to chemo very well. And there are several different courses of chemo, and she put my case before an interdisciplinary board of cancer specialists, which I love that both my oncologist and my colorectal surgeon do. They put my case, they go over the details and put it across all these other experts, whether they're gastrointestinal, other cancer specialists, other surgeons, and everybody comments on what the best course of care might be. So it's really neat knowing that I have this. Not only my team I know of, my 3 or 4 docs I see, but there's this whole other group who are looking at examining my case and looking for, commenting on it, putting their heads together and looking for the best outcome. So she talked to them, and she said for me, she wants to be as aggressive as possible because I'm young, I'm otherwise healthy, and want to get back to a super active life. And we can afford to be a little more aggressive with me, she said, because I'm healthier to begin with and I may handle the chemo better than maybe someone who had heart trouble or diabetes or was a smoker or something like that. So she said the more aggressive course of chemo is rougher. She said it's not fun. And I said, well, what are the symptoms? She said fatigue, so being tired and cold. So are the main things. And I said, what about my hair falling out? She said, no. She said about 30% of patients may have some thinning of their hair, but they certainly don't lose it. Now, breast cancer, on the other hand, you'll just lose all your hair when you go through that course of therapy. This is a different course. So tired and cold, and the way the chemo works is they're going to install a port in me. So they're going to put me under, and this happens Wednesday of next week. This is Thursday, so less than a week from now, I'm going to get a port installed where they run a line into one of my arteries near my heart, and then it just stays there. So basically it's something sticking out of me that they can just inject IV or transfusion into without having to stick me in my arm. And let me tell you, I'm excited about that because I've been stuck. I've had so many IVs and blood draws over the last 3-4 weeks. I feel like a pincushion. So I'll be glad. I mean, I don't want to wear this thing around, but it makes everything so much easier. So get the port installed next week. PET scan is also next week. Tomorrow, Friday, we're Thursday today. Tomorrow, Friday, I'm getting my liver biopsy, and I asked her about that. I said, hey, what should I expect with that? Because it's going to be a long needle, and they're going to be sticking it in various parts of my liver from the outside of me, and it's got to be big enough to take out samples of the liver. And that doesn't seem like it'd feel too good. But she said, you shouldn't feel anything. So I said, yes, I am on board with that. So they're going to have me under, I think, partial sedation, and then I think they'll do some local anesthetic around there as well. So she said she seemed like it was not going to be any big deal. It's a 6-hour process from check-in to prep to procedure to recovery. They observe you afterwards. So I have my buddy Mark picking me up. Mark's awesome. Thanks so much for that, Mark. I appreciate you, brother. So he'll be taking me home so I don't have to drive. Now, so far we've had CT and MRI. She showed me my pictures. And let me tell you, so the tumor is about that long. It's up to 5 inches long. It's kind of oblong shape, something like this, something like that. And she showed me the view down the barrel of my bowel. And I was picturing the bowel being closed, maybe something like this. And so there's less room, but there's definitely some. No. The amount of space that's left is about this much. So there's about as much as the diameter of a pin is all that's left. And so no wonder I've been having so much trouble with bathroom trips. There's just not enough space for things to go through there. And it hurts, it backs up behind there. Without getting, to too much information here, it does not feel great. It means you can't fully evacuate with a bathroom visit. It can cause pain, cause bleeding. So anyway, no wonder I'm hurting, basically. Now she also said she did a bunch of blood work and found that I am extremely anemic. So I'm really low on iron, so I have iron deficiency anemia, which is great news because I've been so run down lately and I thought, well, maybe that's just the cancer. No, not necessarily. So if you're anemic, it means you don't have enough iron to go in your hemoglobin in your blood, which carries oxygen to places where it's needed. So if I can't get oxygen to my brain and my muscles, I'm just going to feel fatigued. So I'm increasing my iron-rich foods that I eat, and as soon as we get my port in, then she's going to do iron infusions, I think once a week, which is the super fast way, easy way to get iron into you. And she said, do not under any circumstances take iron supplements, and here's why. So any of you who have taken iron supplements, ladies in particular, you may notice it can upset your stomach. It can constipate you. Well, the last thing I need is constipation, because that's what I'm already going through anyway. So, which leads me, she told me too, that if you ever get to the point where you cannot have a bowel movement or urinate, which both are difficult but stable right now, she said, if you ever get to the point where you can't urinate or have a bowel movement, that's an ER trip. She said it to me twice, because bad things can happen quickly. So yes, I have a lot of trouble, but I'm managing well using various things. I'm using Miralax, which helps. It's a laxative, and staying really hydrated and avoiding super high fiber content stuff, just to make things easier to flow. So yeah. She also brought up the possibility of, I believe it's called a diversion. So she said, if you do start having trouble with bowel movements, like more than you already are, and maybe you're missing some, and you're starting to have pain and distension and bloating and nausea and stuff like that, which would be the signs that, hey, things aren't transiting through. She said we can do a diversion, which is an ileostomy bag on the outside of you. Again, no one wants that unless you can't poop, and then you really want it, because it can save your life. And yes, it's a hassle, but it would be a temporary thing. It's not a permanent thing. It just means instead of trying to send all the food that I eat through this really narrow opening at the very end, we divert that food into this bag, so it doesn't have to try to force its way through. It just easily goes into the bag, and it's something I would wear on my side. And I temporarily opted out of that for now, just because I'm managing okay for now. But if things take a turn and it looks like, oh, this is trending worse, then I may consider that. That ileostomy, just to be clear, is something I'm going to have anyway after my bowel resection. So when they take out the section of my bowel with the tumor on it and then reattach the new end, I will have to have an ileostomy at the same time, just because we can't use the new attachment right away until it heals. So I'm going to have an ileostomy anyway. The only question is it a separate surgery and done earlier and keeping it for longer, or is it something that we wait until the bowel resection to do? The chemo course, I'm having a Keynote chemo class today in an hour. We're doing it by telehealth, so they're going to go over all what I should expect, how to prepare for it, how scheduling, all that stuff. I'm not sure how, oh yeah, I am sure. And it's going to be a course. Basically, I go into the office and I'll have my port, and they'll hook a bag of the chemo to me. I don't know if it hangs out here, or I don't know where it sits, but I'll have a bag that is hooked into my port, and it's kind of a steady drip over, and it'll last for 2 weeks, I think, or maybe a week. It'll last for a week or two, and then they take a bag off, and so every other week I'll be getting another bag. She said most of the symptoms, side effects I'll have from that are going to be toward the end of that week. So day 1, 2, 3, 4, maybe not too bad. Day 5, 6, 7, I'll start feeling more fatigued, feel cold. But she said shouldn't be any vomiting, shouldn't be any nausea. You just feel run down and general malaise is what she's expecting there. So I think that catches us up. I'm still in great spirits, and so honestly, so she said I was really low in iron and also really low in B12 and folate, which are both B vitamins. So I went yesterday, she prescribed me B12, I think I'm taking 1,000 micrograms a day, and folate, I think I'm 800 micrograms a day. I've taken those twice now. Honestly, my energy levels feel better already. And I haven't even started addressing the iron deficiency yet, other than trying to eat some more iron-rich foods. I had I had a big plate of mussels and garlic butter yesterday. Mussels are actually really high in iron, as are oysters and red meat, but I'm going to try to keep it on the seafood side just so things are easier to digest. So that's the news for me, and I'll have more news for you. I'll check in after my biopsy tomorrow and try to shoot another video, whether it's tomorrow or the next day, and just kind of let you know what that felt like and maybe show you if I have any scars or anything, and kind of fill you in on what that's like. So thanks for watching, and until next time, I will see you guys.